There are four different types of collagen, and there are some clinically important pieces to keep in mind. Type 1 is the most abundant, and you'd find it in all the places you'd expect: bone, tendon, skin, fascia, dentin. It has high tensile strength and very thick fibers. The genes it encodes by is the COLA or COL1A1 and the COL1A2 genes. And if these genes become mutated, we can see pathology in osteogenesis imperfecta, which is brittle bone disease, because a structural defect to collagen occurs. Some other clinical signs and symptoms of this condition include blue sclera, multiple fractures, and hearing loss. Type 2 collagen we find in our cartilage, hyaline cartilage and elastic cartilage. It's the primary collagen of articular cartilage, the cartilage between our bones and our joints. It can be degraded in osteoarthritis, and mutations can cause achondrogenesis or Stickler syndrome, which is not on your blueprint, but can cause essentially destruction or dysfunction of cartilage formation. Type 3 is much more thin and flexible. It's often found alongside type 1. We see it in skin, vessel walls, the GI tract, and even the liver. And in pathology, Ehlers-Danlos vascular type, we can see type 3 become affected. That can lead to vessel and organ rupture risk, and it's a CO3A1 or COL3A1 mutation. Lastly, our type 4 is found in basement membranes of all our epithelial and endothelial tissues, which it forms more of a mesh sheet. The pathology is with Alport syndrome, which is a COL4A3, 4 or 5 mutation, where we see progressive renal failure and sensorineural hearing loss. It also is degraded in Goodpasture syndrome due to anti-GBM glomerular basement membrane antibodies. So how would you remember these? Type 1 is bone and skin. Type 2, cartilage, two C's. Type 3 is reticular blood vessels. And type 4 is basement membrane, the walls, the foundation. Some other significant components of collagen. Collagen synthesis starts with transcription and translation of pro-collagen chains, which are alpha chains. We then will have hydroxylation of proline and lysine, which this is a step that requires vitamin C. There then is the triple helix formation in the rough endoplasmic reticulum, and then glycosylation and secretion as procollagen. From here, in the extracellular space, procollagen is cleaved of polypeptides, and then it's cross-linked with fibrils, and this requires copper-dependent enzyme lysyl oxidase. So we need both vitamin C and copper for this process to take place. In scurvy, vitamin C deficiency, we're unable to hydroxylate proline or lysine, and so we have unstable collagen, which leads to bleeding gums, perifollicular hemorrhage, poor wound healing, etc.